Hello everyone, my name is Ashish Rahi, Assistant Professor in RPIIT Institute of Pharmacy, and today my topic is about the diagnosis of irritable bowel syndrome, that is gastroenterology disease. In this, according to this criteria, you must have signs and symptoms like abdominal pain, discomfort in pain, stools, cramps, stool pass after eating any meal, or constipation, sometimes diarrhea, sometimes stool pass problem, bloating, gas. These are the main symptoms and signs which depict the sign of IBS. And there are some diagnosis criteria like change in the frequency or consistency of your stool. You may change have normal stool, or sometimes watery stools, or sometimes loose stools, sometimes hard stools, or urgency or empty your bowels completely, mucus in the stool, bloating, abdominal distension. And there are some additional tests like lower part of the colon with a flexible lighted tubes, and there is a CT scan, like CT scan produce X-ray images of internal organ of your intestine of your colon. Other is the colonoscopy procedure, in which the doctor depicts the diagnosis as a small flexible tube inserted in the colon from your backside. Lactose intolerance test, it is an enzyme you need to digest the sugar. The lactase intolerance test is a test for lactase is the enzyme which found in dairy products. When someone has to celiac disease, we can say that someone use milk or milk products, it causes abdominal pain and cramps. So these are the lactose intolerance tests. These are the tests to diagnose IBS. Thank you.